So good morning, everyone. Welcome to 75th session of International Weekly Meeting in association with CMAAO. And we are meeting every Saturday, same time. And I would say good evening and good night for somebody. Good night is usually the end of the topic and end of the session, but I think people over here are joining even at 1 o'clock. So how important is this session? It shows up. Thank you everyone for joining it so late. We have special topics coming in, and today we are focused on, again, COVID updates from various countries. This pandemic has really confused a lot of people on what's going on around the world, which we have never expected 2 years ago. Today, we are taking an update on most of the countries with a special focus on US, since we have seen a lot of cases rising in US still. It is still not settled down. So we have Dr. Monica Vasudev, who is an allergist and a clinical immunologist from US. She will cover the update on the US. What is the COVID status? What is the vaccination status? And she's been with us since we have Dr. KK as well, and we are blessed to have all those sessions. And after Dr. Monica covers it, we will have all other people from the National Medical Associations to give an update from their country. So over to you, Dr. Monica, for presenting your data.
Thank you, Saurabh, and thank you, the association with CMAAO for allowing me to give an update today. I know I'm joining after a few weeks today, but I think this has been a very important week coming from the US perspective. I'm just going to share my screen right now. And so what I'd like to start off with is showing you that we have added and are in a surge multiple cases that are affecting both adults and children since August, and particularly in the last 2 weeks. What you are seeing is the effect of what we had recently was our Labor Day weekend, as well as the return to school. The return to school is done in a staggered fashion across the country. We have the southern states that begin typically several weeks before the northern states, where you can have school starting in the first to second week of August, all the way up until after Labor Day. We just had our Labor Day in the past weekend. In the dark blue, navy blue bars, you're seeing the child cases, where adult cases are being seen in the lighter blue. And you can see that they're pretty much following each other in terms of the number of dark blue and light blue cases that are going up and down together. So this is for the data in terms of the week of September 2nd, and we do know that these numbers have continued to increase in the past 7 days. Looking specifically now at the children cases, clearly, as you can see with the new number of cases added in the left side, that these numbers have really gone up as these kids are going back to school. In terms of school reopenings, children and COVID, as of September 2nd, we had over 5 million kids who tested positive for COVID-19 since the onset of the pandemic, and 252,000 cases were added in the past week, which was the largest number of child cases in a week since the pandemic began. So we're in a much more difficult situation now than we were ever during this pandemic. Looking at the number of cases, but now looking at the unvaccinated, which I think is the biggest issue. So how are we addressing these infections? One is looking at masking, and then the second is looking at immunizations. And I'm going to look at immunizations here. What we are seeing across the board is that those who are unvaccinated, they are making up the majority of the adult COVID-19 hospitalizations. So if we look at the data here from January to June of 2021, those who are 87% of those who have been hospitalized are unvaccinated. 5.8% received their second dose less than 14 days from their second dose. 5.7% were partially vaccinated, and only 4% were fully vaccinated. And in a preprint that was published just recently, I believe it was published yesterday, what you can see here is that people who are not vaccinated against COVID-19 were 11 more times more likely to die of the disease and 10 times more likely to be hospitalized with the disease. So when we're dealing with hesitancy towards vaccination, the data is very compelling as to why we should be vaccinated, yet we are still seeing those who are holding out. This is just Wisconsin data in terms of the state that I work in. This is looking at data that was updated on the 18th of August. You're seeing the total number of cases of people who've gotten COVID who've been vaccinated in the light blue, and then again in the dark blue, you're seeing those who've been hospitalized. So the majority of people who've been immunized and have gotten infected, very few are requiring hospitalization. In the not fully vaccinated, not only are you seeing that there's a marked increase in the number of people who are getting infected, you're also seeing an increase in the number of hospitalizations, and now you're seeing deaths as well. And this is data per 100,000 people. So what are we looking at when we're looking at the share of the population of who are fully vaccinated against COVID-19? And this is, again, data from September 9th. And you're seeing the countries across the world in terms of the state of vaccination. And we're about in the 50% range in the United States, where Canada is doing much better. So the big news has been, I think since the second or third week of August, many healthcare systems in my state, and I think this was being mirrored across the country, were requiring vaccine mandates. So that required anybody from those who were in direct patient care versus any employee of a healthcare system to have complete immunization by a set date, whether it be like October 14th, November 10th, with backtracking 3 weeks, 4 weeks, if they do the 3 week, 2, 3 week or 4 week immunizations, or the one Johnson & Johnson vaccine, and given a date that they had to get these vaccines done to stay employed with that organization. They allowed for religious exemptions and medical exemptions. For example, I heard of one patient who had a case of Guillain-Barré, and it was felt to be virally triggered in the past, and she was given exemption due to the concern for recurrence of Guillain-Barré. I know that there's been a lot of effort being put in by these healthcare organizations to review the exemptions that have been submitted by employees, and I'm not quite sure how many of these exemptions have been granted. I know that I have been asked to write letters for exemption, given the allergic component, but in the world of allergy, we do not have good enough tools to be able to rule in or rule out a potential allergic reaction. So that was in the second or third week of August, and we are beginning to see it, at least more in the rural healthcare areas, that we are seeing employees that are now deciding to have a change of career because they do not want to fall under this vaccine mandate. September 9th, Joe Biden, 5 p.m. Central Time, released a new mandate stating that anybody or any organization that accepts dollars for healthcare, that's the Medicare or Medicaid program, have to have every employee that is vaccinated, and requires every federal employee to be vaccinated, and said that any business that had over 100 employees needed to either have proof of vaccination or have weekly testing provided, or that they would face a fine. So some of the initial reactions were, well, if I have a 100 employee business, then I'll try to go down to 99 so that I don't have to fall into this. Or some businesses have actually applauded this because they felt that if they try to enforce this, that there will be employees that will be going across the street to a rival business. There's been a lot of conversation regarding this. We are definitely at an impasse. People are feeling the fatigue of the pandemic, and there's just been a lot of emotion that's been directed against the immunizations. In terms of the schools, I talked about the number of increasing cases among children. This week, again, I believe this was on Thursday, that the LA Board of Education had voted to require students 12 and older to be vaccinated against the coronavirus if they attended in-person classes in this public school district. So this is the first major school district that has mandated vaccination. Just other updated news regarding addressing points related to vaccine hesitancy. This is an article that was published in JAMA on September 8th. And what you're seeing here is that just one more piece of information to say that COVID-19 early in pregnancy is not associated with an increase in risk for spontaneous abortion. COVID-19 vaccine was received within 28 days prior to an index date among 8% of ongoing pregnancy surveillance periods versus 8.6% of spontaneous abortions. The other thing that they are looking at is the co-administration of the COVID-19 and the influenza vaccines. We also are required by our healthcare organizations to receive the influenza vaccine on an annual basis and provide proof that we've received it outside of our institution. Moderna said on September 9th that it was trying to develop a booster dose against COVID-19 along with the flu shot, because most of us will be, if not in the immunocompromised ESRD category, anticipating a booster dose, we'll probably get it at the time when we typically receive the flu shot, so as to minimize the number of pokes and to get it all in one. They're putting on that together. They're also trying to look at RSV and COVID-19 vaccine as well. We are seeing an uptick in the number of RSV cases in the community, also as school has started. Novavax said this is going to be September 8th now, initiated an early stage study to combine its flu and the COVID vaccine, and it expects this to be critical in combating the variants. So you can see that these are the biggest highlights these are the biggest highlights in the United States. So I just tried to give you a brief summary as to what we saw this week. Thank you.
Thank you. Thank you, Dr. Monica. For the US update, Dr. Monica is an allergist and clinical immunologist in US. I will open the floor for the question answer, since this is an important country update where we have not been covering this for a while. And I also would then open the floor, and then we will invite all other countries for the update. And we also have Dr. Chong with us, the chair for CMAAO. Anybody has questions?
Yeah, thank you, Dr. Basudev. Excellent presentation. I just like to clarify that during vaccine hesitancy, 8.6% spontaneous abortion in a pregnant woman. Does it due to the vaccine, or it was COVID-19?
8.6 was spontaneous abortion in those who received the COVID vaccine, and 8% in those who had not received the vaccine. So.
Okay, no, thanks. Thank you.
Yep, you're welcome. That was actually published in JAMA. That was not a preprint.
Monica, great talk. The pediatric cases, how fatal is the pediatric COVID disease compared to the adult COVID disease? Because there was a myth initially that children don't get sick, they don't get into ICU, they have more ACE receptors in their lungs, they have thymus for immunity. But what reports we are hearing from the southern belt, particularly from Mississippi, Florida, Georgia, is the pediatric ICUs are full. And there's a lot of severe disease and deaths in the pediatric population also. So I think we should break that myth that children are immune from COVID. And which is why probably there is a need for a pediatric vaccine also, to say that you give them influenza to save influenza deaths, and don't give them a COVID vaccine just because it's not available. I think there's a lot of discrepancy in that. So what are your thoughts on that?
Yeah, so great question. So I was actually trying to break it up and trying to find out, because with the children, we have 12 and older that can get vaccinated. So I was trying to find out the hospitalization rate between those who are vaccinated and not, and finding out the mortality rate. And I couldn't find that data, sorry, in that amount of time. What I do know is that there is a hospitalization rate of 0.1% to 1.9% of COVID cases in kids. So that is what we see, and that the mortality rate, where there are the states that are reporting, it's up to just 0.03% of all child COVID cases that are resulting in death. I think that why we're seeing more hospitalizations, that I think that more kids are getting infected. I don't think that this is a function of like the virus being more virulent in this population. I just think that the denominator has increased in the terms of total cases. But this is just my preliminary look. I need to dig in deeper. I was not able to find the specific information.
Dr. Monica, I have a question, and I think schools in India has been quite a big debate. So in US, how does it work? Like, are these children being forced to wear masks? Because wearing mask for the children is very difficult. Adults are not listening, so I think children are somebody who will become little careless. Second, if somebody is infected, so they call off the entire class or they call up the entire section. How does it work there?
So a great question. So the approach to the pandemic last year was very different. Last year, they had options for online versus in person. And then if somebody was sick, then an entire classroom might go back to online learning because they had an alternative available. We had schools that were providing Chromebooks to all the students. There were teachers that were available. This year, there's no online learning that has been even made available. It's you go to school or you are not going to school. My children go to a school in what's known as an independent school district, and they have a mask policy. They can take their mask off when they're eating lunch. They can take their mask off when they're outdoors. And right now the weather is still conducive that they can go outdoors. As the winter comes upon us, and they are outdoors, of course, they'll be all bundled up anyway, wearing scarves and hats. That is not the case universally. Where I work, in the public school district, in the area that I work, it's mask optional. And I'm already hearing cases of children having fever. They may or may not be COVID positive, but they're definitely getting RSV, they're getting regular viruses. So in the US, everything is variable, and there's a lot of emotion towards making people wear masks, and everybody wants to have a choice to wear a mask. I have teachers who are patients, who are dysregulated, I'll use the word, maybe if not completely immunocompromised. They're worried. You have college teachers that are telling college students to keep the mask on their face. So there's nothing universal. I think the equation changes based on the spread of the virus in your community. If you're surging, then obviously it makes sense to have kids masked. If you're not surging, then it's, you have to use your decision. And then it's also based on whether or not you have vaccines that are available. They did a survey in our school, and it appears that out of the survey sent out, 94% of the parents responded. 75% of those 12 and older received the vaccination. 4% have received one dose, and 4% had a plan to receive the immunization. So I think it's very local dependent, and I think every school has to look at the culture of its own students and its parents.
Okay, Monica, can I say this is Dr. Kaisar Sajjad from Pakistan?
Good morning.
Yes.
Okay, thank you very much, Saurabh. Actually, what Saurabh has indicated about the children's vaccination or to follow the SOPs, the same debate is going on in Pakistan also. The parents are very much disturbed that the owner of the private school associations are wanted to open the school, and the government wants not to open the school, but in some places it's open now, and the problem is that the government wants to vaccinate to 12 to 17 years children, but the situation is that I think it's not yet started the vaccination of the children. But my question is, maybe I miss your presentation. My question is that which vaccine is good or safe for the children age from 12 to 17, and either it can be given a 2 dose with the same quantity of dose, 0.5 ml, or what it was, 1 ml. So can you say or clear the situation, number one? Number two is, what as an association, what we educate the people, either people asking, either we send our children to school or not, what is the situation now in the of the corona in the city or in Pakistan. So this is very difficult for us to, it's already lacking the education of your children. So I don't know what, as a national association, how can we guide people, or how can we guide the government?
So that's a great question. And the problem is that every school and the parents and the students, the attitudes can be very different. So let me answer the first question first, and that was the vaccination for the children. In the United States, we're only giving the Pfizer vaccine. Pfizer vaccine got full approval, full FDA approval for 18 and older. For those between 12 and 17, they're still under emergency use authorization. The dose of Pfizer vaccine is 30 micrograms given 3 weeks apart. And those that are even 12 to 17 are getting the same as the adult dose. They are currently studying 10 microgram levels for those that are, I think it was like 6 months until the age of 5. And then they're doing another dose, which is 3 micrograms, which is between 6 months and 5, and then 10 micrograms between 5 and 11. So 6 months to 11, 6 months to 5, 5 to 11, and then 12 and older. 12 and older are getting 30 micrograms, 5 to 11 are getting 10 micrograms, 6 months to 5 are getting 3 micrograms. And those will be given 3 weeks apart. Now, if your private schools want to keep the schools open, and you have the ability to control the number of students in a classroom, and you're able to have masks for children all the time, and you can enforce that. If you have hand hygiene, you have masking, and you have and you don't have a surge, or you have a contact tracing method where kids can have the ability to get tested easily, teachers can get tested easily, and then you can close down the classroom until if there's a positive case. That's a scenario where you can have schools that are open. But if this is logistically difficult, then I think opening schools will actually give you a surge of cases, just like we saw in the US. I showed you the graph as schools were opening, the number of cases have gone up much higher than they have since the beginning of the pandemic. Our parents, I'm a parent, I have my kids, I want my kids to go to school. This has been going on way too long. I feel like they're missing out on critical skills that they need to acquire at this age of development. This is the feeling of every parent regarding their child. I'm fortunate that both my children could get vaccinated, but what do we do if we can't get vaccinated yet? And that is, you have to really control the class size. You really have to make sure that they're wearing masks, and you really have to make sure that you have a strong contact tracing method.
Excuse me, can I ask a question, Monica?
Yes, definitely.
I'm Dr. Salma, President PMA, that is Pakistan Medical Association. I'm principal of a girls' medical college, and in our hostel, I have 500 plus girls. If a girl has symptoms like fever or body aches or anything, I try to do a rapid antigen test because I get the result within half an hour. If I go for PCR, it takes 24 to 48 hours. But the physician here sort of recommend PCR and they're not very interested in rapid antigen, but for practical purposes, whatever results I've seen, I think where rapid antigen is positive, the PCR is positive, and it suits me because we can remove the girl from the hostel and take care of the affairs. What do you suggest? What is the difference between the test and which is better?
So the PCR is going to be a lot more specific, and your antigen test is going to be, or your rapid antigen is going to be a lot more sensitive. I believe whatever test gives you so if your student has symptoms that are consistent with COVID, pre-test probability is high and a rapid test is negative, you're going to treat her like she has COVID anyway while you're waiting for the PCR test. If her clinical suspicion is low, she's contact but asymptomatic, and her rapid is negative, she's negative, right? And if she's positive, then you have your answer. So I believe that the rapid test is a great, very accessible way to do it. And you should use the PCR test to confirm negative tests if you have a high index of suspicion.
Thank you, Monica. That's what I've been doing. Thank you.
Thank you. It's fantastic. Thank you.
Hi, Monica.
Hi.
Hi,
Good
Monica.
morning.
This is Dr. Benny Atienza from the Philippine Medical Association. I'm also a pediatrician. I was not able to take your lecture. My question is, what are the most common signs and symptoms of COVID in your area?
So that's a great question. So obviously we're looking for fever, we're looking for cough, and we're looking for body aches. But the other thing that I'm seeing in children is fatigue. They're just very, very fatigued. You may not even notice that they have the fever, and they may not have the nasal pulmonary symptoms at all. So if you have a child that all of a sudden starts sleeping a lot more than usual, then I would probably suspect testing for COVID.
Because here in the Philippines, I encountered that one of the symptoms is diarrhea, and some of my adolescent patients has symptoms of anosmia, like in adults.
Yeah. We're not seeing so much in the older kids now because they've been vaccinated since June, so maybe the presentation is a little bit different for us right now. But yeah, many of my patients have not had diarrhea. Diarrhea does not seem to be a big presentation for at least in the locality I'm in.
How about the mortality rate among children?
The diet?
In adolescents? Mortality rate.
Mortality rate. So the mortality rate, well, according to the American Association of Pediatrics, is 0.03%.
Thank you.
Angelica, you want to go next for the question?
Thank you so much. And thank you so much again, Monica. It's always a pleasure to listen to you. Monica, I've got two questions. One is for clarification, and Salma raised it, if I'm not mistaken. I've been in a meeting this week where I was told that if you do the antigen test, you have to do the PCR test as a follow-up, even if the antigen test was positive. And I said, no, if an antigen test is positive, it's positive. You don't need to follow it up with a PCR to make sure. And as far as I know, it's not compulsory. I just want to double check on that. But my real question is, in South Africa, we're now going to go onto the Sinovac trial. And I think Malaysia is also one of the countries that's been in Chile has been earmarked. And I've got a bit of a concern regarding from 6 months up till the age of 12, because how do you really look at adverse reactions and side effects? Because how does a 6-month or a 7-month-old baby tell you that I've got a reaction against the vaccine? I'm a bit concerned about that. Just for my own clarity and sake, do you have any opinion on that? I do have no problem with children from the age of 12. And I also do recognize that a lot of the toddlers would be a reason for spreading the virus to the parents and the grandparents, simply because of the crash in South Africa. They're all back in the crashes. And we are seeing again all these RSV, exactly what you have said is coming back. So just about 6 months to up till 12. Thanks.
Yeah, so this is a great question. So as an allergist, I'm asked to evaluate patients who get multiple vaccines at once. Normally during the childhood immunization schedule, they're not getting a single vaccine and then there'll be a reaction. It's no different than any other vaccine that we're giving to children, except that it's a novel vaccine for their age group. But even though it's been it's now been given in many older children and adults. The major things that you do see with children is rashes. It'll all be dermatological manifestations. You might see vomiting, you might see diarrhea, you might see coughing, you might see wheezing. But I think the most common reason that I get a referral for evaluation of immunization adverse reactions is due to a dermatological manifestation. It'll usually be a widespread exanthem, or it'll be a widespread urticaria, or it'll be worsening of eczematous dermatitis. But I don't have any information, and I'm sorry, I didn't look into this a little bit more detail as to what the preliminary data is showing regarding this population age group. I do have a friend who actually enrolled in the 5 to 11 group in Chicago, and he's another allergist, and his son actually got enrolled and he ended up getting placebo. So he knew that later. But otherwise, I don't know. I don't have any firsthand knowledge regarding what they have found so far.
Great.
Thanks,
And
Monica.
you asked about the antigen test too. Sorry,
Yes.
there was a question about
Please.
that. Yeah, so the advice that I give, either one is being pragmatic and then the second is being theoretical. So my response before was on a pragmatic basis, that if your pre-clinical, pre-test suspicion is very high for COVID-19 infection, and you have a rapid test that is positive, I don't think you need to go to PCR unless you need to use the PCR for advancement to the next therapy, like use of monoclonal antibody therapy or something like that. But for the purpose of isolation and early intervention, I think that the rapid test is appropriate. If you have someone who's just being exposed and has mild symptoms, has been immunized, and they have, and you really need to confirm based on their ability to return back to their regular schedule, then a PCR test is definitely good. But I do believe that we're underutilizing the rapid test to make quick clinical decisions.
Thanks, Monica. I agree with you. I'm actually a supporter of the rapid test in the setup of clinical practice. As a GP, that's what you see. You see these patients coming in, and you need to have it too. I can't wait for a PCR, and it's quite expensive in South Africa to get a PCR. The antigen is very, very cheap, and as long as you do it in the right window period, then it's, for me, it adds a lot of value. Thanks.
Any specific restrictions on the travel going on in US? Like US has been known for traveling within the states, I would say.
So as of August, all I had heard is that if you were traveling to Hawaii, that you needed to be either immunized or you needed to have a negative test before travel in those who are unimmunized. If you're traveling to Canada, which they had opened up to US citizens who are immunized, the cutoff 72-hour test was, they held you to the 72 hours. So if you were crossing immigration at 73 hours, they had you return back to get another test. But otherwise, I'm not seeing anything except for the fact that the most recent update that I didn't include was the TSA, which is the Transportation Authority, that is just doubling the fines if you're not wearing a mask in the airport.
Okay. I think we should have one special session on children. I think there was a last week news that those children hospitalization is getting surged in US and few other countries, I would say, but US primarily. So we should look into that aspect. Yeah. Any other questions on the floor? Otherwise, we will go with the regular country updates.
I'm sorry, I joined late.
We were missing you, Dr. Chaudhary.
Thank you. Dr. Manika, of course, I do not know whether this question has been answered or it was raised, the question was raised. So this is the question actually, which I'm asking because we are opening our schools here from tomorrow, and we are concerned that most of our children are not vaccinated, even from 12 to 18, you can say. Only we have given the opportunity to get vaccinated from 18 to 25 in case of the students. Above 25, everybody is allowed here. So we are worried about that. And can you just update us about the US actually just has opened long time, and we heard that the school children are getting more affected. Rather, it is said that it's 1:4 actually in terms of the number of infections. The students are getting infected. The children are getting infected more.
Yeah, so there's lots of variables right now. That's a great question. One is that we have Delta in the country, and we know that the R naught factor for Delta is much higher, 5 to 8 or even more. We know that with schools opening in person, last year we had schools that were opening and had a program for virtual schooling, which most of the schools now have said no. We know that there has been a strong push for making the use of masks voluntary instead of mandatory. There have been isolated areas where people are trying to put mask mandates. We know that a lot of children initially were waiting when they started getting immunization. I had shared data earlier that my children are in an independent school, and that there was a more than a 75% immunization rate in those that were 12 and older. So it's very, very regional. In schools that are opening and are trying to reopen, it's really important to keep the class size small, keep the ventilation good, have them wear their masks on their face, on their nose, and not on their chin, and making sure that they have hand washing. And during periods when they're not wearing their masks, such as when they're eating, to make sure that there are appropriate distancing that is provided. Now, that is not very easy in every setting, right? Because now all of a sudden you're only able to put half the number of students in a place that you were able to put twice the number of students. It is going to require a lot of creativity and a lot of goal setting based on the students and the administration of the schools to decide, does everybody need to be in class? Would you have an A day and a B day where you have half the class school go on A day, the other half go on B day, and give them homework on the other day so that you can socially distance, for example, or you can do 1 week on, 1 week off. And that would give parents and teachers a feeling that there are some measures that are being taken. These are just some ideas that were being used in the United States last year when they had virtual learning, but this year there's not many virtual learning opportunities, and we're seeing the surge in the cases. So we're still learning with you.
Thank you, Dr. Monica. Actually, Bangladesh also is trying to do this sort of things. Actually, I'm not sure in detail. So the other thing is that actually about the booster dose of the vaccine. Actually,
Yes.
there are a lot of talks actually that the US started. Actually, one of my friend in our webinar, he has just expressing it that yes, all of them are given chance to. All the people are given chance for booster dose, but I oppose because you sent one, I think one link there I've seen, and from Canada also recently I was informed that no, they are giving only to the immunosuppressed and other special type of people, special category. What is about the US?
So in the US, if you go, you can register for an immunization at a local pharmacy. You can go to a hospital. Wherever you register for a booster dose, nobody's asking you for verification of immunosuppressed status. They're not saying, are you on prednisone 10 milligrams a day? Are you on Humira? Are you on any immunosuppressive therapy? They're not asking you for your creatinine level or what your GFR is to see if you have ESRD, CKD. So if my patient says tomorrow that I want to get the third dose, they will go get the third dose. But any patient that crosses my path and they fit the recommended criteria today, I do counsel them to get the immunization. The first question that they always ask me is like, I've not been 8 months away from my immunization. And that's not the case. You do not need to wait 8 months from when you got your second dose of your Moderna, Pfizer, or in our case, with the single dose Johnson & Johnson. they can get their third dose right now. I believe that we don't have all our information regarding the third dose. I am not gotten the third dose yet. I'm not immunosuppressed. I don't have chronic kidney disease, but I do anticipate that the booster dose will become available to us. And when it does become available to us, I will get it.
Do you suggest for antibody test for before third dose of the booster?
The antibody test doesn't mean, it doesn't, I don't know how to interpret an antibody test and my risk of infection. I don't know what it tells me. It tells me that I got the antibody from either an infection or the vaccine, but I don't know if that's telling me that my B cells are working and I'm making antibodies, but I don't know if that equates to clinical outcomes in terms of infections. I know there's been small studies, but I actually do not test antibody levels, nor do I recommend it.
Thank you.
One of the questions which has come up is, has any, like this is for the floor, post-COVID complication for long COVID, bilateral hips issue. Has anybody come across that?
Yes. We routinely see bilateral hip joint necrosis. And it's now been emerging as a normal complication of long COVID. And we have had many patients where we have done hip replacement also. And it can come as late as 6 months also.
Okay.
I have a question, Dr. Joshi. Is that also related to prolonged systemic steroid exposure too? Are they having bilateral avascular necrosis because of area under the curve regarding systemic steroid exposure? If they continue to have symptoms, there's another course of steroids. There's another course of steroids.
It is directly proportional to the steroids.
Thanks. Okay, so let's open the session for the floor for giving an update. So Dr. Chong, would you like to take it over? I would like to announce all the people who are here. We have Dr. Chong from Singapore Medical Association. We have Dr. Ravi Naidu from Malaysian Medical Association. We have Dr. Ashraf Nazmi from Pakistan Medical Association, Dr. Alvin from Hong Kong Medical Association, Dr. Pillay from India and World Medical Council, Dr. Salma from Pakistan Medical Association, Dr. Angelica from South Africa Medical Association, Dr. Chaudhry from Bangladesh Medical Association, Dr. Hussain from South Africa Medical Association. We have Dr. Mukti from Nepal Medical Association. She's not here today, but yeah. Then we have Dr. Sajad from Pakistan Medical Association, Dr. Prakash, again from Nepal Medical Association, Dr. Benet from Philippines Medical Association, Dr. Deborah from Brazil, Dr. Marie from Japan, Dr. Shashank Joshi from India COVID Task Force, Dr. Monica Vasudev from US, Dr. Sanchita from India. And we also have some other guests over here from various parts of the world. So open to the update, and Dr. Chong.
Thank you, Saurabh. So good to see everyone again. And we'll just start with the country updates. And maybe I'll just call upon Marie, Japan, to tell us what's happening. Marie?
Thank you very much. We have survived from the fifth wave right now, and maybe the end of this month, we can declare the mild lockdown. That's good news. Dr. Monica mentioned that they, also in Japan, the children is infected more than the other waves, but no serious cases reported among the children. Most of the children are asymptomatic or very, very mild case. That means that they are easy to spread all over the classmates. So we are pretty much worried about the classroom, and but we are opening the school right now, and we will see what will happen to them carefully. Thank you very much.
Thank you, Marie. And Deborah, would you like to update us with what's happening in Brazil?
Hello, good day for all. It's a pleasure for me to be here and to see all you with a good health. Here in Brazil, the deaths are decreasing. 3 days. In 3 days, they are decreasing. Here, the Delta variant arrived here, and we don't know exactly what we will have in these next weeks. But today, the deaths are decreasing, and we have more than 30% of the population vaccinated with the 2 doses. And yeah, we started to give the 3rd doses for the older people, and the government thinks in gave it to the medical and the nurses and the other health professionals. Okay, and now we are just waiting. The children, it's not a problem today, but it started to appear children with COVID-19.
Thank you.
It's for instance.
Okay. Thank you, Deborah. And I'd like to move now next to, can I have Dr. Chowdhury? Can you update us with what's happening in Bangladesh?
Yeah, thank you, Dr. Chong. Thank you, everybody. Bangladesh actually is passing better days now. Our number of infections has come down. It is near about 2,000, something like that. That's positivity rate is near about 8%. And the number of deaths also is reduced, actually. That's 37 yesterday it was. And the vaccination is going a bit slow, you can say, but we are not getting much vaccine. But the government, the health minister is telling that you are getting more next month, from next month, something like that. And we are hoping that even our minister who visited the Indian minister, he has confirmed that yes, we may get it from October, end of October or November, more vaccines from there, which was stopped actually due to the escalation of the infections there. So we are getting from China and some from COVAX, but still it's only 12% only first dose vaccinated, and the second dose got only near about 5% of the population. So it's very less, you can say, in comparison to our neighbors. So, but the thing is that from tomorrow, the schools are opening, and we are worried actually before that, yes, I don't know what will happen actually. But even like Dr. Monica was mentioning, that we are getting those protocols actually not to just social distancing, so that maintained and the hygiene is maintained, everything like that. So that way they are trying to open the school, and they're saying that if it is escalating, then it will be stopped again. So everything is open here, everything. Nothing is closed, everything you can say. So, but surprisingly, the number of infections is less. But we are worried about the India also. Sometimes you see the India is getting higher, the numbers. So that is also my concern. Thank you so much.
Thank you, Dr. Chowdhury. Maybe we'll hear from Dr. Salma, Dr. Prof. Ashraf, and Dr. Sajjad on what's happening in Pakistan.
Good morning, everyone. Good day, in fact. In Pakistan, the Delta virus is still there. Last week, it had crossed the 4,000 and the 4,700 people per day were being infected. But yesterday, it was 3,700, which is good news. So far, 26,000. And we have given 6.6 crore vaccines have been distributed. So if there are 2 doses, that means 3.3 crore. I don't know how you work in millions, but probably this is 30 million have been vaccinated. So we've closed the schools, and the NCOC has said that they'll not open. Initially, they were going to open this Monday, but they've extended it more for another 2 days, and then they'll sit and decide further. So unless this drops to 1,200 or 1,000, probably the schools are going to be shut, because in our schools and in our community, somehow people are very shy of wearing masks. And we keep on telling them to mask themselves, to mask themselves. That's the only prevention. Let's hope for the best. That is it for Pakistan. Thank you.
John, can we invite Hong Kong first today? Otherwise, we'll miss him out at the end of the time. So we'll invite Hong Kong first today.
Okay.
We have Alvin.
Where's Alvin? I don't see him on.
I just saw him joining.
He's
Dr.
trying.
Alvin,
I don't know. He's not here.
Okay. He's not connected
shall
to
we
the
just
audio.
shall we just get Prof. Ashraf and Dr. Sajjad to finish up with Pakistan? Prof. Dr. Sajjad?
Yes, I'm sorry, Dr. John, I'm sorry, I missed your call. I'm sorry. Can you repeat what you are asking for?
Just an update.
Hello?
Anything to add from your end?
Okay, now what the Dr. Salma said, it's correct, but I just want to add something that in Pakistan, we are facing a lots of problems in school, opening of the school. And the government has imposed the mandatory condition for the parents, those parents who want to send their children in the school, they have to vaccinate it. The parents should be vaccinated, number one. And the number two is that all the school staff should be vaccinated. That school will be open, otherwise not. So in some places of Pakistan, like Punjab province and some area of Punjab province, the school is remain closed till 15th of December as the number of cases increasing at that area. And regarding the vaccine, at least what the government announced, according to the government, 50 million people have been vaccinated completely, fully vaccinated in Pakistan. This is all we want. I want to add on what Dr. Salma said. Thank you very much.
Thank you, Dr. Sajjad. Prof. Ashraf, you have something to update us?
Thank you very much. I think both of my colleagues, President and the Secretary General, have very nicely talked about Pakistan. But only if you allow me to appreciate the best lecture from Monica, and thanks a lot for the excellent presentation and updating the real status of the COVID around the world, including the United States, indeed. One thing just I would like to speak about the Pakistan issue, that the government has not allowed still the rapid testing, and we are stressing upon as association and a social worker upon the government that PCR is not only enough in Pakistan, and the testing capacity in Pakistan we are performing, it is not more than 50,000 to 60,000 per day. And positivity rate overall in Pakistan, it is about 6.4%, and it is going to be the stationary graph, and it is positive. And what Dr. Sajjad said, that it is the 15th December, it is 15th September. We have the 24 districts, and we see in Pakistan that how the virus is, spread of the virus, and then the decision is about the closing of the schools and so on. Here in the part where I live in Pakistan, we support the government to close down the schools, because it has been noticed in Pakistan that the spread of the virus is there due to the children going to the school. And so we are on the supportive side of the government, closing down the schools and the movements overall. Pakistan is, alhamdulillah, now we are stable and going better, and we expect that within the next 2 weeks time, we'll be able to open up the Pakistan, although it is the fourth now we have in Pakistan, and the Delta virus is mostly, it is about the 90% of the cases, this is for the Delta virus. Thank you very much indeed, giving me this opportunity.
Thanks,
Dr.
Prof.
Chong. Dr.
Yes,
Chong, sorry.
yes, Dr. Sajjad.
Sorry to interrupt you. I
Sure.
just take an advantage to just would like to know about the attitude of the people in Pakistan and in other part of the world, that those people who have been vaccinated, they think that no need to have any mask or social distancing, anything. So this is a big problem. What I am observing, that people are saying that no need to wear mask. What about? Why? No, I have vaccinated. No problem. No need to take any distance or something. You know, they are refusing to follow the SOPs. So what anybody can guide us as a national association? How can we on the television, we are just expressing and we are very vocal to just follow the SOPs. Even you have been vaccinated, don't lose this SOPs, otherwise you will have it. Number one. Number two is unfortunately we have lost our doctors, even vaccinated. And what we feel and what we have inquired about how it is happened, then I come to know that in the beginning, the doctors and other people who have been vaccinated and infected, they don't care in the beginning. They denied that I cannot have this coronavirus because I have been vaccinated. So this attitude, a very dangerous attitude. How can we proceed in this situation? Anybody can say about
Dr.
that.
Sajat, thank you. Actually, later on, I'll show you some Singapore data, very interesting, reported by our National Center for Infectious Disease on what TTIQ, that is trace, test, quarantine, and so on, actually brought the R naught of Delta down to 1.45. I'll show you later some of the data when it's my turn. Just hang around, and it'll be very interesting data.
Dr. Chong, in response
yes, Dr. Chaudhary, yes.
In response to Dr. Sajjad's query, actually, it's very interesting, actually, this is the reality here also. But, we have to come out of the statistics here, because I can see the interest for vaccination in Bangladesh is huge. We cannot supply them, we cannot provide them, but there are a lot of responses because they have seen those who are vaccinated, even then they get infected, they're going to the hospital, but they're coming out easily. That is actually the answer. So they got interested. These also the things, if we can show by the research or by the study that yes, if you are vaccinated and if from them actually there's somebody is getting infected and not wearing mask, not wearing protocol, not following protocol, so that will help. Otherwise, no. Otherwise, you cannot do that. Otherwise, one thing is that I have seen in Nepal, still it is compulsion to go with the mask. Even they have vaccinated nearly more than 20%. So anyhow, it's good. Still, it's there.
I'll show you some interesting data afterwards. Let's get Dr. Prakash from Nepal to report on what's happening in his country. Dr. Prakash?
Thank you, Dr. Chong. And good morning to all and namaste. Because in Nepal, nowadays, the infection rate is less than 10, and the complications and death is very much reduced because most of the hospitals are vacant. More than 50% beds are vacant. That's why just in Nepal, we are telling to all that vaccine can prevent the complication and death, not an infection. That's why we are telling all the persons the masking is compulsory. Either they are fully vaccinated or not. And in the same way, the vaccination coverage is increasing day by day because the government has the first priority of vaccine. Because the new Prime Minister also told 1 month back, he has a top 3 priority. First priority vaccine, second priority vaccine, third priority vaccine. That's why the government is day by day, they are buying, they are getting the vaccines around the neighbors and around the world also. And in the same time, now, since last week, I think, we are in new normal. Most of the shops, public places, everyone is open, and nightlife is also it's open to all. But still, we are telling that the testing is not increased as we expected, because only the symptomatic patient in the border and in the international border. Only we are doing the testing, but the testing we are doing the PCR also, and in the same time, rapid antigen test also. That's why the infection rate is looking almost 10%. And we are not doing the mass testing. And let us see, by the next week, school will be opened all around the Nepal, but in new normal condition. They have to follow the public health measures. They should provide the masking compulsory. They should provide the sanitizer also, hand washing also, and the physical distancing also. That's why we are in new normal. Hope so the infection may not get increased. But till now, whatever infection we have, all belongs to the Delta variant. And just when last week we sent the cross-checking of the genome sequencing in the India from the Nepal also, all the 48 samples became the Delta variant only. Thank you all from Nepal.
Thank you, Dr. Prakash. Dr. Joshi, Sashan, can you update us with what's happening in India? Especially the two states, Kerala and Maharashtra, I believe.
Yeah. Yeah. So as far as India is concerned, clearly there is a decline in total number of cases. Initially, we were putting out around 50,000 cases a day. That has come down to 30,000 cases a day. Kerala has started becoming more stable. We are seeing a gradual decline. And the good thing in Kerala is the case fatality rate is extremely low. So the hospitalization and the burden on healthcare infrastructure is very low. Maharashtra is also reasonably flat. So there are two new districts of concern, but there are a lot of festival seasons. Right now it is the Ganesh festival here. And people are worried that people will not mask. Bengal may be the new hotspot because it is having an RT-PCR test positivity rate of around 6%. The Northeast states still remain to be a cause of concern. Overall, India is flat now, and the total number of active cases still are around 3 lakh plus. And per day output varies between 30,000 per day to 40,000 per day. Overall, this appears to be the tail of the second wave. And the third wave looks to be a little distant. The good news is in the immunization front. India is probably the fastest vaccinating country after China. China data is not available in public domain that easily. And a large proportion of a very high population, we are the second most populous nation in the world. We have 130 crore as our population. Eligible population of adults is around 90 crores, of which around 70 crores we have vaccinated. So that's a very large number which we are doing. And therefore, the vaccination rate is something which we are looking at very aggressively. And that's something which we are trying to do our best. Currently, 40% of the world population, India population has got at least one vaccine dose. And around 12%, 12.5% have got fully vaccines. We are also getting more vaccines now. Novavax will be approved anytime now. The Zydus 3 DNA vaccine is approved. The Covaxin has finished the pediatric trial. The interim results will be available. So we'll have two vaccines for children, one for adolescents, the Zydus COVID, the DNA vaccine. So we can stop sharing. And second is, of course, the Covaxin, which is going to be available. It's a killed vaccine between 2 to 18 years. So that interim results will be presented to the subject expert committee of DCGI next week. So we'll have two vaccines in the pediatric space. School has been a big thorn of debate. Non-exposed states and zero COVID districts or very low COVID districts are opening up schools now. But the mandate for schools are three. The full school staff has to be fully vaccinated, number one. Number two, masking is mandatory. And number three, we are starting with rural and primary schools first, and then moving to urban and secondary schools. But unfortunately, some states have done the reverse. The other thing is that beyond masking, we are now trying to up the genomic testing. So the genomic testing still shows that the Delta is the preponderant virus even now. The Delta plus case still remains Delta plus. We have not reported more than 200 cases of Delta plus. And all those cases, surprisingly, unlike the Delta plus in the UK and Nepal, have not been sinister. So the outcome has been reasonable. We are getting breakthrough infections after first and second dose, but that is something which we recognize, and the disease is mild and less severe. So we continue our mask and vaccinate policy. Hopefully in another month, things should look better. We anticipate the third wave if there is no new variant of concern or interest around December or January. Thank you.
Thank you, Dr. Shashank. Always a pleasure listening to you. Can I hear from Dr. Benito from Philippines?
Yes, good afternoon. As of yesterday, we have 17,964 new cases. Then we have a total of 1.9 million of cases since the start of the pandemic. And regarding the death, we have 168 death yesterday. Our schools are still closed, and we have increasing number of children being infected with COVID. And those the ratio of those admitted with COVID is 8 out of 10, 8 with no vaccines and 2 vaccinated but moderate to severe.
Thank you.
And we last week we the Food and Drug Administration the approved under emergency use the Moderna vaccines for 12 to 17 years old. That's all.
Thank you, Dr. Benito.
Dr. John,
yes.
just one thing, because Dr. Benito was telling that can you just recognize those who are infected after first dose as a breakthrough infection? Can we say, or just only 2 weeks after the second dose, if he is getting infected, then you can say breakthrough? You got my question? You got my question?
Can you repeat the question? Those
no,
give one dose.
I was just asking everybody whether the breakthrough infection, which one will say? Whether we can say also the one getting infected after first dose, or only 2 weeks after the second dose. Who is getting
most of the infections among doctors, those died, and those that had infections had only one dose of the first, the Sinovac. However, there are less doctors that had previous injection of Sinovac.
No, I'm not telling that. I'm just asking who will be categorized as breakthrough infection, whether the person getting after the second dose, 2 weeks after second dose is getting infected, those who will say breakthrough infections, or even the getting infected after first dose. I think first dose, is it categorized as breakthrough infection, Dr. Monica and Dr. John, what do you say?
Sorry, Dr. Chaudhary, don't quite understand your question.
No, because after getting infected after first dose, will you consider it as breakthrough infection? Because he hasn't completed it. So after 2 weeks after the second dose, if he's getting infected, then only you can say, yes, it is a breakthrough infection.
Okay, so is it how do you classify natural infection?
Yes.
I see, okay.
When you calculate the breakthrough, that what will be considered? Dr. Monica, can you give us an idea?
Or Dr. Shashank, can you give us an idea?
Yeah.
Sorry, can you repeat the question again?
Yeah,
I think he's asking what is the definition of natural infection? Does it include those who are partially vaccinated or just those who are non-vaccinated at all?
No, not vaccinated, no. Breakthrough.
Let me clarify 3 things. Number 1, there is naive COVID, which is first vaccine, first time without any vaccine. So unvaccinated COVID is the naive infection or native infection. Second is, technically breakthrough infection can occur after 1 dose or 2 doses. So can occur in partially vaccinated or unvaccinated, or the fully vaccinated. So that definition of breakthrough has not been well defined. Every research paper has had a different definition. If you look at various studies across the world, some have used breakthrough by and large breakthrough is used when they are fully vaccinated.
Yes.
Okay. But some people have called this as immune escape also. So, different people have used different terms at different places. So Dr. Chaudhary, I would request you for that paper in the methods and material, they clearly specify. most of the breakthrough papers have assumed the breakthrough after full vaccination.
Yeah.
That is how it is assumed and presumed. But some people have used the word breakthrough even after one dose. Ideally, the true definition of breakthrough from a puristic standpoint is you give 2 doses and wait for 14 days. That is the true definition of breakthrough.
But is it justifiable?
After that, only you will call it breakthrough. So it is more of semantics. For us, any person who gets vaccinated fully after developing antibody and gets a breakthrough is the true breakthrough. See, what means that means he developed some degree and did not mount an immune response. Dr. Monica probably can clarify on this also, but that is where I would look at as a true breakthrough. Because what do you mean by breakthrough? That this broke through, the infection broke through despite of the vaccination, which means the body failed to mount an immune response. And the third category is reinfection. Reinfection, we heard Dr. Shastri telling us about reinfection, which also can occur. Now, in order to distinguish reinfection in people who have already been infected, ideally we need genomics. And it's not easy to do genomics. For Dr. Veena Agrawal, we were able to do the genomics because she was fortunate enough to get genomic access. But that's not possible for everybody.
Good reply, Dr. Shashank. I hope you're happy with that, Dr. Chowdhury.
Yeah, but truly, actually, because if you just show the real picture of breakthrough, the people will be interested more for vaccination. If you take real picture, what Dr. Joshi was telling, if he's fully vaccinated and getting infected, that number will be less. Other than because after the first dose, people are getting less antibody. It's not strokes, so we are giving the second dose. So after second dose, and even 2 weeks after the vaccination, that you can consider as a breakthrough. That will be better. So that people will be more interested to get the vaccination. Yes, if I get 2 doses, I'm free. I'm okay. But I think that nowadays, the breakthrough infection is considered as first dose also. After the first dose, if it is getting infected, that is also calculated in the in breakthrough. So what about the idea of Monica? Monica?
I think that the issue of breakthrough infections is, why are you getting tested? Are you getting tested because you're traveling? Are you tested because you're symptomatic? Are you testing because you're exposed? To me, a clear definition of breakthrough is that you're 2 weeks post-immunization of your second dose. But people getting immunized should not be told that, you're immunized and you're not going to get the infection. That's the wrong message. The message is that you get immunized and we are preventing, or we're reducing your chance of hospitalization, severe disease, and fatality. That's what the message is. And it doesn't matter what your antibody level is. It doesn't matter anything. We are giving you immunization to help your immune system overwhelm the infection before the infection overwhelms you. Very simple.
Thank you.
Okay, can I just update everyone what's happening in Singapore? I don't see Alvin. Is Alvin around? I don't think Alvin's around. So I'll update you what's happening in Singapore. We've got some interesting data. Can I share screen, please?
Yes, you can.
Okay. So this is my latest, our Straits Times newspaper. And this is our NCID director who has said that's her. And very interestingly, she has mentioned that the R0 of Singapore, because we have very, very good tracing data, 100% of our people are all using the Trace Together app. So we have a 1.45 R0 in Singapore, as opposed to 5 to 8 that is commonly, touted. So we have managed by just using trace, testing, isolate, quarantine, and on top of the very, very good vaccination rate, we brought it down to 1.45. So obviously below 1 will stop the infection. But as it is now, we're still getting 600 plus cases today. And most of them are mild. So the serious number of cases is actually just about 26 of them. Hang on, I'll share screen again for the other, yes. Okay, can you all see this?
Yeah.
Yes, okay. So we have 600 plus cases today. Yesterday, 400 plus cases. But what's interesting is that we already have vaccinated 83% of the population. 92% are eligible because 8% are below the age of 12. So at 83% versus 92, we are only 9% away from complete vaccination of the whole population. And that's where we are at the moment. Now, just want to show you some data. So you can see when it comes to pediatric, right? You can see that those who are very young, below 11, 95 cases out of the 631 in the hospital. And none of them require oxygen. The children do not require oxygen. And you can see that in intensive care, we only have 7 persons, despite having 600 plus in hospital and 600 cases a day. So what we've done with the vaccinations is that we have changed the disease. The disease has become very mild. And this is another very interesting graph. This shows the fully vaccinated. There's hardly anyone who is in oxygen, that needs oxygen. Those are the purple bars. And you see those who are partially vaccinated and completely unvaccinated, much bigger purple bars. And also those who are in ICU are in orange bars, and the orange bars are much bigger as opposed to those who are fully vaccinated. So in many ways, we have changed the disease, you know, and I think the way forward is not easy. Of course, looking at the number 600 plus, you know, our leadership here is bulking a bit and getting a bit terrified, because you know and I know that the ICU cases will come later. But till today, it's still 6-7 cases in ICU. And our capacity is about 1,000 beds for ICU. So we are far away from being in trouble. But still, nevertheless, the numbers are going up. And a lot of this is very mild and asymptomatic spread. So despite the fact that we've brought it down to 1.45, we're really seeing a really different situation right now, you know. So that's where we are in Singapore right now. Thank you.
But I had Dr. Chong. Can I just have a question to you? Just I heard that you people are expecting that it may go up 2,000.
Yes, that's right. Because the numbers are just increasing every day. You know, today is 600 plus. Yesterday was about 570. Today is 690. Yesterday was 664. The day before was 500 something. You know, so the numbers are just going up every day. But like I said, we have changed the disease. The disease is no longer, and you know, you only have 6 in ICU, 7 in ICU. And you saw from the data just now, the number that require oxygen. There are 631 in hospital, but most of them are quite mild and asymptomatic. And so now, as of today, we have changed the stance. We have asked people who are COVID positive to stay at home, right? They no longer need to be in hospital unless they need oxygen or they're very ill. And one more interesting thing, we were mentioning ART just now. In Singapore, whenever we go for a swab, we also do the ART because the swab takes about 24 hours to come back. So we do the ART immediately, and there's a protocol if it's positive or if it's not, okay? So there's a protocol. If it's positive, this is what we do. If it's negative, this is what we do. And we wait for the PCR to come back. But we do both at the same time. So that's where we are at this point in time. Border restrictions, very interesting. Over the last 11 to 12 days, you know, we have quarantined thousands of people coming home from everywhere, but we've only picked up 31 cases in quarantine. So if you're having 500-600 in the community and you are only picking up 31 during quarantine and quarantining thousands of people, wasting resources, the question begs whether we actually need to quarantine people coming home, or just ask them to do a PCR and then ask them to stay at home, you know, for a while.
Dr. Chaudhary, I'm sorry, we will hold the questions. We still have a couple of country updates. Can we ask these questions next time? We still have only 4 minutes left. Yeah, we have Angelique, we have
Dr. Hussain. Yes.
We have Dr. Hussain, and we also have Dr. Elvin joining in now.
Okay, great. Angelique and Dr. Hussain.
Thanks. I'll be very brief. We are getting out of our third wave. I'm extremely happy. We have a raging debate currently on compulsory vaccines or vaccination. There will be a paper released from the MAC Advisory Committee within the next 2 to 3 weeks. And we are also looking at getting the healthcare workers who were vaccinated with Johnson & Johnson to look at a booster for them on Johnson & Johnson before we have our fourth wave, which we suspect will come around about December. I leave the stats to Dr. Hussain in the interest of time. Thanks.
Thank you, Angelique. Thank you, Dr. Chong. The new cases last 24 hours in South Africa, 5,885. And also the death is 281 in last 24 hours. Total tests done in South Africa, 17 million, and 2.8 million have positive cases. Our recovery rate was 93.2%. And last 24 hours, 10,726 patients admitted in hospitals around the country, 1,621 in ICU, 930 patients were on ventilator. And testing positive rate now 16.2. From the last week, it was 22%. So numbers are going down. Thank you. Thank you.
Alvin, do you have something to tell us? Thank you, Dr. Hussain.
Yeah, thank you. Nice meeting you here. And then we are, still the same like last week. We didn't have any new cases in a way in the community. So only a couple of those entry at the border, they have a little positive confirmed cases entering the border, but those are all mutant variants, of course. So the containment is still okay now in Hong Kong. So we are now still following China's policy, the strategy of zero tolerance, because we in Hong Kong always like to have the open border with them, but now that they are still very hesitant to open border to Hong Kong, the mainland. So, but we are optimistic. The vaccination rate is now catching up to 50% of the whole population for the first dose, and almost 50% for the second dose as well. So we are optimistic in a way that we hope we could have 70% of the population being vaccinated by the end of October. But on the other hand, the threat is that less and less people are now interested to go to get the vaccination like any other places in the West. That is up to 50 or 60%. That's a plateau. Just like in Israel, they did it very fast at first, but then up to 60%, then they level off. In most countries in the West, I think it's like that, because I think there is a significant faction of the population are anti-vaccine. The anti-vax people, they are very stubborn. And then those who had been threatened or deterred by the initial, negative news that had really scared many of the elders and some very meticulous, careful people. They don't want to have the side effects of the vaccines. So these people will have the quote unquote prejudice or their mindset fixed that the vaccines are not safe to them. So, and in Hong Kong, there's also a political factor, just like I think in Israel and other people, those anti-government people would not go for the vaccination just to give you the lessons, So I think it's difficult to cross the 70% mark to me in Hong Kong's population, because some are politically very, 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 very obsessed. And but then I will still be optimistic in a way, at least in China, mainland China. I think for people in the China, it's not difficult for them to have 80% vaccination rate like Singapore.
And then the Chinese people would be well protected more, and then they would feel comfortable to open the border to Hong Kong at that time, perhaps. At least, I think, at the time of the Winter Olympics, they would have to open somewhat to allow the tourists, the spectators, and then the people working for the Winter Olympics to enter the country without the strict quarantine, I guess, just like in Tokyo. And then at that time, perhaps China should be well prepared by the 80% vaccination rate, I think. So anyway, that's all about Hong Kong. Thank you very much.
Thank you. Thank you very much, Alvin. Thank you all. I think we've come to the end of our session, and the other meeting is coming in. So thank you again for Monica for the wonderful presentation. All participating. See you all next week.
I'll just
thanks
quickly
for Deborah for
announce
joining us from Brazil. I know it's very early in the morning.
Yeah, I'll just quickly announce for the next week topic. We have already a speaker, and it will be one of the very important topics which we have not covered over the all the sessions. It's a role of diet in building immunity, inflammation, and insulin. And we have speaker Dr. Miss Isha Khosla. She's one of the renowned nutrition and a very good speaker. So I would request everyone to join that session, and we can have a lot of question and answers on that front. Thank you, everyone.
Thank you.
Thanks. Bye.
Thank you.
Thank you. Thank
Be
you.
safe and